Whiting at the Arirang newsroom, and we're breaking into our regular programming to bring you the latest briefing from the South Korean health authorities that should begin momentarily. In the meantime, we do know that South Korea on Sunday confirmed 30 new cases of the COVID-19 virus. Let's take a listen now. They're starting just at this moment.
In addition, we also have Yoon Tae-ho present, and we also have Hwang-Ju Kim present with us today, and we will also be providing sign language translation. First, we will hear from Minister Park Nung-hoo about the countermeasures against COVID-19. I am the first Vice Head of the Central Disaster and Safety Countermeasures Headquarters, Minister Park Nung-hoo. As of August 2nd, as of midnight, there were 8 community spread that were newly confirmed, and there were also 22 imported cases. In total, there are 14,366 cases confirmed until now, and 806 people are still being treated. We did not see an additional case of deaths yesterday, and until now, 301 people have passed away. In Korea, in terms of the newly confirmed cases and treatment, we are stably controlling the disease. And for the past 2 weeks in Korea, on a daily average, there were 16.9 people newly confirmed, and compared to over 21 from the previous 2 weeks, there was a decrease by around 4.5 people. And until August 1st, we actually have seen 9.1 people being confirmed in terms of the community spread. So we see that the number has been increasing. And in terms of the unknown causes, it has been decreased to 6.6%, so it is nearing 5%. And also disease control measures are nearing 80% as well. And in terms of newly confirmed cases, we are seeing scattered cases in the metropolitan area. And for the Chungcheong region, Gwangju, and Jeonnam region, in the non-metropolitan areas, we see that numbers have been stabilizing. And for the people who are being treated, this is being maintained at less than 1,000, so we are controlling at a level that it can be maintained. And for hospitals and hospital beds, we still have room with around more than 2,000 remaining. And for people in severe cases, we are maintaining it around less than 10 people. So we are providing the best treatment to people with COVID-19. And on the beginning of May, we went into everyday life distancing, and we saw a trend of community spread increasing at one point. And it actually increased to more than 69 people at one point, so we saw an exacerbation. That was a crisis for us. However, we believe that we were able to overcome such a crisis, and we are now at a stable stage, and we are controlling and containing COVID-19 at this point. This is all thanks to the efforts of our citizens who have shown mature civic consciousness. Similarly, there are countries who try to go back to the stable economic situation while being able to control COVID-19. However, for those countries, they are facing difficulties. And we see such a difference in Korea because of the efforts made by our citizens. And we want to express our gratitude to the citizens who have followed and practiced frequent hygienes despite all the inconveniences. Still now, we see cluster outbreak happening in a scattered manner in metropolitan areas, and as such, we still have to make sure to follow and practice frequent hygiene, thinking that we are at the front lines. So we want to ask you to follow the measures on everyday life distancing. We are able to contain COVID-19 that started again in May. However, COVID-19 will be prolonged, and we will have to live together with COVID-19 for a long time. As of August 2nd today, across the world, there have been more than 81 million cases being confirmed across the world. and it is still spreading very quickly. And in the fourth emergency committee held by WHO, they have said that they believe that this wave will be prolonged for a long period of time. Not only in Europe, but in Middle East, US, and the Latin Americas, a lot of the countries are opening up their boundaries and also opening up restaurants once again. And we believe that this is leading to an increase in additional cases being newly confirmed. And for Asian countries such as Hong Kong, Singapore, and Vietnam, we see similar cases happening there as well. And this is showing how difficult it is to contain COVID-19 and how the spread could exacerbate if we were to become slack. And in such a situation, we see an increase in imported cases in Korea as well. And since this is inevitable, it is important for us to be able to manage the imported cases. Over the past 2 weeks, on a daily average, there were 21.7 imported cases. And this is similar to the previous 2 weeks. We have said this on multiple times. We expect COVID-19 to stay for a long period of time, and as we live together with it, we have to make sure that we also actually resume exchange with other countries. When we consider globalization and the world trend, we have to make sure to be able to exchange with other countries because otherwise it could harm our economy. And considering this, we're going to continue the principle of openness, but in order to be able to contain imported cases, we are doing our best. First, for everyone who is coming in from abroad, they will be tested and they will be put into 2 weeks quarantine. And because of this, it is actually with very low possibility that they will be spreading COVID-19 to community spread. And we are also limiting flights, and we are making people submit the results of COVID-19 diagnosis tests if they want to come to Korea. And we are also strengthening measures in blind spots. By taking such countermeasures, we believe that imported cases of COVID-19 will lower, and we believe that the risk will lower as well. And in the future, we will also take precaution and be monitoring it very closely. It is very necessary sometimes for us to protect residents residing abroad, and such a demand is increasing at some points. And as a result of testing people who are working abroad, there were some cases that tested positive and they're being treated. And for people who tested negative, they are staying at the life treatment centers and they'll be put under quarantine in a safe manner for 2 weeks. We are supporting these citizens because we believe that this is the obligation of our nation, and we are going to continue to do our best to protect our citizens. The number of imported cases is increasing, and one measure that is really important to contain this is to make sure to run the temporary life treatment centers. And this is a way that is blocking COVID-19 from spreading across community spread. And this is also a very safe facility. For residents who reside in areas where the life treatment centers are being installed, we want to ask for your support as well. COVID-19 is a part of the future that we cannot avoid. So it is very necessary for us to look into measures to support these. And government is also taking part in it. First, for the ultimate dissipation of COVID-19, we are making efforts to, as a part of the government, to come up with vaccines and treatments. And in case of another massive wave of COVID-19, we are also making preparation to stock up on the medical and protectional equipment as well. And we are also making sure to relieve the fatigue felt by our medical practitioners and the voluntary personnel. And at the same time, we are also monitoring the measures on the diseases that are not COVID-19. We are also opening respiratory clinics, and we are also having the public safe hospitals so that we can support our citizens in other measures as well. Due to COVID-19, our life has changed, and sometimes it can lead to depression and tiredness called corona blue. And in preparation for such a phenomena, we also have to make sure to look into our minds and our hearts. Another important task is the following. So we not only have to look into disease control, but we also have to find a balance between disease control and economic activities, and we have to make sure that this is successful. We were able to contain COVID-19 well. However, if this leads to a difficulty in the livelihoods of our citizens, we cannot say that this is a success. Therefore, ultimately, we have to make sure that we prevent the undermining of our nation's capabilities. So we have to make sure to develop a safe environment, but also be able to form an economic activity that is vitalized as well. And we also have to make sure to come up with a social system that is not a burden, but is coordinated. The government has confidence in the efforts proven by our citizens, and we believe that we will be able to become a role model for other countries as well. Right now, the disease control measures are somewhat stable, and we believe that this will be a golden time for us to be in preparation for a new social system. So the government will make sure to strive hard to come up with the perfect system. Our society, every time there was a crisis, made collective efforts and were able to overcome difficulties wisely, and we were able to achieve the current disease control measure that we have now. We were able to control and contain COVID-19 that had a massive outbreak in March and April, and we were also able to block cluster outbreaks. And at the same time, we started opening up schools for our children. And until now, we were able to contain massive and cluster outbreak in schools. And we are going to open up more schools in the future as well. We have a difficulty of increasing confirmed cases coming in from abroad, but we're going to make sure to strengthen the measures and be able to contain it. And we are preparing measures for that as well. Now, our society has focused on a new risk, which could be the summer vacation. With summer vacation, a lot of our citizens will move around and will have activities. And we believe that the victory of COVID-19 will come up at the end of summer vacation, and this will be a watershed point. A while ago, there was a cluster outbreak that happened in a camping site, and this is showing that there is a risk of COVID-19 spreading due to summer vacations. We ask you in this vacation to refrain from going to crowded places, and we ask you to stay at home or go to very vacant vacation sites. And we also ask you to move in small groups. And we also ask you to distribute your vacation days as well. In vacation sites, please make sure to refrain from going to crowded and closed spaces. And even if you're outside, please make sure to wear a face mask. And please make sure to follow social distancing as much as possible. And I want to repeat this once more. We want to make sure that we continue to maintain this current situation because we were able to contain the massive outbreak in May. So we want to ask you to remember that once again. With summer vacation, we believe that you want to take a rest. However, while taking a rest, please make sure to practice the disease control measures and frequent hygiene wherever you are. We also want to make sure that you have a safe time, so we will do our best as well. Thank you.
And that'll conclude our coverage of this briefing. Thank you for watching. Arirang News will be back at the top of the hour.
With social distancing measures getting updated,